Good morning and welcome to our presentation today. I am seeing it's 11 o'clock on this Friday morning. Let's pause and give ourselves just a moment to allow people to register. Before diving into the presentation, though, I am going to go over a few logistics to make sure you know how you can interact with today's webinar and learn more. With that in mind, you are all utilizing the GoToWebinar control panel and platform. As a result, on your right-hand side of your computer screen, a control panel should have popped up. In there, you will be using this dashboard as your way to interact with today's presentation. At the bottom of the control panel, you will see a handout section. Within there, we have attached 4 different handouts today. These are supplementary handouts that will help you dive further into the presentation and interact with it on a more personal level. Additionally, these handouts can be used after today's presentation, and we encourage and hope you utilize them. So please download them. Should you have any issues downloading these, whether it's due to locks at your business or organization or because of technical errors, please reach out to me at elena@imhipteam.org, and I'm happy to send those to you. Additionally, we will be sending out the presentation as well as these handouts after the fact. So if you don't need them just this moment, I'm happy to send those out afterwards. Additionally, you can utilize the chat and question function to submit questions to me. I am showing up as IMHIP support, so please feel free to send those, and I'm happy to answer those at the end or along the way. With that in mind, I'm going to go over a few more logistics before we dive in. We are going to have a lot of attendees today, but we would like for you to interact with today's presentation, so please submit those questions in those chats. There will be a few opportunities for you to ask questions. After our history and our overview, we will do a short pause, allow you to ask questions on the overview before diving into the presentation. With that in mind, please submit your PIN. By submitting your PIN, that will allow you to speak. If you do not submit your PIN, you will not be able to be taken off of mute and not ask your question. All right, without further ado, I am going to introduce today's presentation. My name is Elena Kennedy. I am the Chief Operating Officer here at IMHIP, which stands for the Illinois Association of Medicaid Health Plans. Today, we will be diving into an overview from the Office of Older American Services and the Illinois Department of Aging. We have 2 fantastic presenters. It has been a joy working with them thus far, and I'm so happy they will be presenting today. Jose, one of our presenters, has been with the department for 15 years. He previously managed the Division of Home and Community Services, and currently Jose is the supervisor for the Office of Older American Services, primarily overseeing grants to the 13 area agencies on aging. Leanne has been with the department for 19 years. Leanne is a regional coordinator in the Office of Older American Services and serves as a liaison to 2 area agencies on aging. Without further ado, I am going to hand it off to them to do further introductions. Leanne, Jose?
Yes, thank you. Yes, good morning, everyone, and we're happy to be here. Thank you so much for that wonderful introduction. We are excited for the opportunity. I'm going to let Leanne say hi real quick.
Good morning. Thank you for having me.
We're going to co-present. We're going to take different sections and make sure, to give you as much detail as we can. Again, feel free to send those questions. They're important, and don't feel bad about it. Sometimes you have a question and somebody else will have the same question. So again, we want this to be interactive, informative, and beneficial. So we are very excited to be able to present today. So we're going to go ahead and start here. We're going to make sure everything's working properly. Here we go. So the a little bit of background. Many of you guys may know. If you already know this, we apologize. But there might be somebody that might not be as familiar with the Older Americans Act. So it would be important to start with that and make sure we have our bases covered, and then we can move forward and tell you what is happening today, several decades later. But in 1965, similar to the Medicaid waivers and a lot of the push from uh, providing home and community-based services in the community as long as it was cost neutral. The Medicaid waiver was amended, and several waivers were created around that time. Also, the Older Americans Act was signed into law back then to create the area agencies on aging, which is basically a way to deliver the services in the community, but it took it a step farther. Part of what the area agencies on aging do is do that grassroots planning and making sure that individually, based on communities, we're meeting the needs of the older adults. And in Illinois, we happen to have 13 of them. So we're going to cover a lot more in different slides here, but that's a little bit of the background. And again, it goes hand in hand with the Medicaid waivers that you guys are very familiar with. Um, Obviously, there is federal funding involved with that. The state of Illinois gets approximately 50 to 60 million dollars, and we also have general revenue funds or state support at this point to complement in the federal dollars that we get. Overall, it's about $100 million in services that we provide in the state of Illinois through the Older Americans Act. And again, the overall goal is to keep people in the community safe and make sure we provide those needed services in the community to avoid any unnecessarily institutionalizations or higher cost long-term care facilities, emergency room visits, and things to that nature, which is why, again, we are presenting today because a lot of you have the responsibility to manage those care plans and keeping people safe in the community. So I think that this is an overall goal from both of our teams. So this is why we're happy to present today. All right. Eligibility, we talked about. There's several protections within the federal law. That, for example, we don't have any means testing. We don't necessarily ask for people's income, but we do try to make some priorities. 60 plus is obviously our target population. The funding that we get from the state and federal is not enough to cover everybody. In the state of Illinois, we currently have over 2.7 million seniors, 60 plus. So our funding wouldn't be enough to cover everybody. So we have priorities. We have, for example, seniors living alone, minorities, poverty, rural areas. Those are some of the things that we like to make sure are part of our discussions when we develop services across the state. The Grandparents Raising Grandchildren is one of the programs that is part of the Older Americans Act, and it helps grandparents raising their grandchildren with several services, whether it's legal. I'm sure you may encounter some of those situations when you do your visits, and we do provide several things to help grandparents, car seats, school supplies, uniforms, summer camps, and things to that nature. So again, this is something that we're very proud to do, and it is available across the state. And we'll get to those in a minute, but this is part of the Older Americans Act in part of the responsibility of caregivers. So this is part of the 3E Caregiver Support Program. And even though we don't necessarily require means testing and things to that nature, we are required to request volunteer contributions. So when we are providing services, whether it's meals or legal services, we are required to ask for a contribution if available, if possible. We do not deny services if somebody cannot provide those contributions. And again, some of them could be $5, $10, some of them could be a lot more, but we are required to request and ask for that volunteer contribution. However, again, I cannot emphasize enough that does not determine eligibility, but that is something that the federal government expects from our services. I mentioned this earlier. We looked at greatest economic and social need. Again, minorities, poverty, living alone, and things to that nature. Low income, minorities, older persons, rural areas. In limited English speaking is another section that we like to. The areas do an area plan planning every year, and we looked at the needs of the populations, and we definitely look for how are they addressing the needs of all these sectors, including the limited English speaking. You're going to see that a lot more obviously in the Chicagoland area, suburban Cook. But again, it's important that we're addressing all of those needs, and then you'll see a lot more difficulties with rural areas, with distances, transportation. So this is the beauty of the act. Every area an agency on aging has the ability to design those services based on the needs of the participants. And every year they should address those issues. They do public hearings in terms of how they're going to deliver those services. So it's very comprehensive and it's very flexible. So that is helpful when it comes to providing those services in those communities. However, from the state point of view and probably from the managed care perspective, it's difficult to definitely understand what's available in every community. So we're going to go into those details farther into the presentation, but that is the reason why there is variances in how we deliver the systems and the services from community to community, but it is a federal requirement that we do that. So that is why you will see a lot of times that the home delivered meal program is administered differently, even though they're counties next to each other, and that those counties follow under a different planning and service area, and that area agency on aging may have a different way to operate in those counties. So that is the background and why we wanted to touch base a little bit on that. Here are the 13 area agents, the 13 PSAs, planning and service areas. As you can see, Cook County is divided into two. 12 is the city of Chicago. We do a lot of work with the city of Chicago. And 13 is age options. Suburban Cook, they've been around for a long time, and they do offer many services outside of what is funded through the Older Americans Act. So they are a great partner. And as you can see, you'll have the different regions, but every PSA has an area agency on aging attached to it. In all of the planning and services and development and coordination that occurs on those services are managed and administered by the area agency on aging. Let's see. Okay. Normally, the AAAs don't necessarily provide direct service. They are a planning body. They're supposed to monitor providers. They're supposed to do, like I said, the public hearing, the coordination, the advocacy, the grassroots planning. In instances, for example, in the city of Chicago already has several senior centers. The city of Chicago already has funding available through the city of Chicago for a lot of similar services. Therefore, it makes sense to join with the city of Chicago to provide those services as a direct service. So by rule, the area agencies on aging are not a direct service providers. However, in rural areas where there is no providers, or in case of emergencies when a provider goes out of business or things to that nature, or when it makes economic sense, when we can deliver the service at a lower cost, if we partner like with the city of Chicago, it makes sense to have a waiver and allow that area agency on aging to provide those services as direct services. The city of Chicago has a 311 number that's advertised for information and assistance. So a lot of our funds also go and cover the operations of that line to make sure that we're providing information and assistance and referral to citizens in the city of Chicago, which a lot of them are 60 plus or a caregiver of a senior in the area. So this is just again some background, but you will see that some PSAs don't do any direct service, and you'll encounter another town, another community, another PSA where the area agency on aging is providing those services. This is why you will see that from time to time. All right, so Leanne, you're going to take over from here.
Sure.
Unless we have any questions, do you guys have any questions? I don't want to go through too far into the detail of the services, but I'm happy to answer any questions about the background and how the system is set up this way. Are you seeing any questions on the chat room, Elena?
At this time, I encourage you to continue moving forward with your presentation. We all hold questions to the end, it appears.
Okay, perfect. All right.
Thank you.
Good morning. Thank you. Good morning. This is Leanne. So I just wanted to spend a few slides going over a comprehensive list of services that may be available in your areas that your members are residing in. So keep in mind, some services are statewide, some are just particular to a certain planning and service area. And then as Jose mentioned, services may look different in different areas. So we would encourage you to build a relationship with your area agency on aging, find out what those services look like, and find out the best way to connect your member to those services. So in your handout that went out with the presentation, I believe, is also a map and a contact list of the area agencies on aging. Thank you. So just briefly, some access services. As you can see, options counseling and information and assistance are available statewide. So anyone in the state of Illinois has access to those services. It's possible some areas are funding assisted transportation, outreach, and then transportation. And I believe we're going to touch on those a little bit later on. In-home services can include things like chore housekeeping. So for example, in the city of Chicago, that may look like services that are beyond what a homemaker would do. So a short-term, heavy-duty cleaning is something that would fall in that category. Friendly visiting is being funded. Home-delivered meals are, of course, statewide. And then you may also have access to respite, residential repair and renovation, and telephone reassurance. Additionally, community-based services, congregate meals are available statewide. Counseling, education, health screening, and housing assistance may be funded. Legal assistance is statewide, and we have a slide on that later to provide some more information. Recreation is available in some areas, and that may include things like Zumba or yoga at a senior center. Health promotion and prevention services are statewide, and those are more evidence-based programs that have been proven beneficial. And then gap filling. So gap filling is kind of, it can be a catch-all, keeping in mind area agencies have developed their own policies and services that they're focusing on. So what I would encourage you to do is if you have a client or member who's in need of something and you don't know where to get it, it's not covered on programs, you may contact the AAA and see if they have funding or know of funding available. So for example, something like Depends, other things that aren't typically covered, they may have funding available for that or be able to put you in touch. The family caregiver services they're statewide, but the AAAs are determining what it looks like in their area. So there's a variety of things that could be funded. So this would be for family caregivers, informal caregivers of individuals over 60. This includes grandparents raising grandchildren, which is also being referred to as older relative caregiver program. And then some additional funding for caregivers of patients with Alzheimer's disease. So public education, information and assistance, case management, counseling and support groups, training and education, respite, and then again, there may be additional funding for gap filling and legal services in this separate pot of money. It's just funded under Title IIIe, so that's why it's separate. Okay, so just a few slides to focus specifically on home-delivered meals. Home-delivered meals would be the only service funded through the Older Americans Act that requires an assessment to be determined eligible. In this case, for MCO members, we're relying on the MCOs to complete this assessment and referral and forward it to the appropriate nutrition provider agency. So those documents are also shared with you, and be happy to share them again if that's necessary. So home-delivered meals would be a daily meal delivery, depending on the area. So this could look different in different areas. It can be hot, cold, frozen. We also have possibly shelf-stable meals for weather emergencies. So we would want you to check with the Area Agency on Aging that your member resides in to see exactly what that looks like in that county. So the area agencies have updated their websites to include hopefully an easy to reach document for MCOs. Some of them have a tab for MCOs, or it might just be under programs and nutrition. I just did check a few to see that it was up there and easily available. Home delivered meals are required to meet dietary guidelines for Americans. So the meals should be 1/3 of what is required. So if you're getting 1 meal a day, it would be 1/3 of what is required. If you were to get 3, you would be meeting all your dietary guidelines for Americans. So they're substantial. They have fruits, vegetables, protein, and what is required. Additionally, the meal needs to be given directly to the older adult receiving the meal. It should not be left outside. This also provides an opportunity for a wellness check on the individual. The driver can then report concerns or changes in the health status because they are doing that daily contact. To be eligible for a home delivered meal, again, this is the only program that requires an assessment. So assessments are conducted by CCUs, MCOs, or the nutrition provider as appropriate. So for MCO clients, we would want the MCO to do the nutrition referral assessment. And I have a few slides on that, so happy to go through that and answer any questions as we go. You must be 60 and older to get a home delivered meal. You must be frail or homebound, and you must live in the appropriate service area where the meal is being delivered. And the Area Agency on Aging, again, would have that detailed information. They would also want to know if you did have a client that was not in an area, that information is helpful to them as they expand their areas and service delivery. Please keep in mind, there are some cases where someone besides the older individual would be eligible. So if they have a spouse or disabled individual living with them, they may be eligible. So you would want to contact the area agency if you have a situation like that. If you do have a client or a member that is not appropriate for home delivered meals, please keep in mind that there's a congregate meal program that they may participate in. It also doesn't require a fee and offers socialization. So we would encourage you to get that information as well and share it with any client that may not be eligible for home delivered meals. Just to share with you a few benefits of home delivered meals, participants have reported that it improves their health, it allows them to stay in their home, and it makes them feel more safe and secure. Food insecurity is associated with high healthcare expenditures. Participation in home delivered meal programs has been associated with lower medical spending. So we covered a few of these things. So MCO responsibilities for home delivered meals. The MCOs do not need to pay for non-waiver services. So all the services that we've discussed, including home delivered meals. What we do need you to do, however, for home delivered meals is complete the eligibility assessment referral form and send it directly to the appropriate nutrition service provider agency as directed by the Area Agency on Aging. And again, their websites should have a page or tab available to share with you a referral, fax or email, probably an email, so that you can send it directly to the appropriate person. Older adults can receive home delivered meals and other non-waiver services without receiving waiver services like in-home services. Again, the AAA has updated their website. We would ask that you inform clients of a suggested donation so that they won't be taken off guard or surprised when they're asked. They're not required to pay for these services, but those voluntary contributions are used to expand the program. And just a reminder, clients need to be reassessed for home delivered meals annually.
And then this goes back to similar to what you guys are already doing for the waiver clients and whatnot. So what happens a lot of times is that if that reassessment is behind, then things naturally start falling behind. So our nutrition providers are oftentimes wanting to get that reassessment completed and whatnot. So you're going to be getting phone calls from that. So again, this is similar to what happens with the waiver participants in the elderly waiver, the community care program. The care coordination units are already doing these questions, and when it's the reassessment, when it's time to do the reassessment, the annual reassessment, they're asking the questions again, and they're sending that nutrition referral to the appropriate side, like Leanne mentioned. So that is the same expectation as you're reassessing your clients. Make sure you ask these questions again and make sure we're capturing the information, and that information has to be sent to the nutrition provider so we can track those and make sure they're still eligible for those home delivery meals. Also on the form, you'll see that there's an emergency box. A lot of times when you're trying to discharge clients or members from a hospital, and you need time to schedule those appointments, but they're going home and they need meals. This form can be completed and forward with that emergency box. That way we can get those meals to them right away.
So I know this slide is a little bit difficult to see, but I wanted to spend a moment talking about the referral form, and it was also shared with you prior to the call. So the form is in two formats. There's a fillable PDF in case you're able to complete it in the client's home on a laptop. There's also one you can print out and easily use. So just a few things to touch on the form. Of course, as I mentioned, there's an emergency box at the top. So if you have a client that needs meals immediately, please share that information with the nutrition service provider. Typically, meals start in a few days, but we would want to convey any emergencies or anyone in imminent risk of a nursing home to the nutrition services provider. We do not want clients to receive meals from Title III Older Americans Act and another source. So if you have an individual that's already receiving meals, it's possible that if they're doing private pay, they may be eligible for these Title III home delivered meals, so they could eliminate the other. So that is something we just want you to ask and be aware of. The other questions at the top. Days the individual needs meals, type of meals, hot, cold, frozen. So this is for your information. So we would want I don't want it to appear that there's a lot of choice here. So keeping in mind that some of these are nutrition service providers are in small areas, and the service package is what the service package is. So that information should be on the area agency's website so that you can share with the client if it's a rural area and perhaps they only serve frozen meals like on Monday for 5 days. So that is just so you can help manage those expectations, but you can fill in on here the need for the client, what meals are needed. If second meals are needed, you can of course share that, keeping in mind that's not available everywhere.
And you can check on their website prior to going to the home visit. That's sure. Another best practice that we encourage with the care coordination units for the waiver. If you know you're going to go to a specific county and you're going to be talking to the individual about potential meals, it's a good practice to get familiar with what's available in that county, so you don't set them up with 5 days hot meals. When in that county specifically, what we do is basically provide one hot day meal on Monday and 3 frozen ones and things to that nature. So again, the idea is to make sure that these are person-centered plans, but also some expectations if they're rural counties. We don't have the availability to provide hot meals every single day, so there might be a variation there. So it's always best to know ahead of time what's available in the county than promise something that is not available there. So this is just a tip there, that it's always good to do that ahead of time.
Thank you. So the next box is type of meal, hot, cold, frozen. The purpose of this mainly is to determine if the client is able to reheat a frozen meal. So if you were to check the AAA website and be aware if for example, frozen meals are only available in that area, you may already know that this client isn't available or appropriate for a frozen meal if they don't have a microwave or if they don't have the capability. So that's just to share that information. And then if the next line, special notes. If you are on the fillable PDF, this field can expand as much as needed for you to share any information that you need to share with the nutrition service provider that's not anywhere else on the form. The rest of this page is mostly required federal reporting. So we do require demographic information, including name, address, date of birth, race, and ethnicity. And so the instructions that are included provide a deeper definition. If you need definitions of race and ethnicity specifically, those are outlined. The nutrition risk screen is also required federal reporting. So we do report to the feds how many we're serving with high nutrition risk. This would also give you additional information to assess what other needs the client may have besides home delivered meals, if they need to be put in touch with other resources to continue to meet their nutritional needs. And then the bottom, impairment of ADLs and IADLs. This is also required to report to the feds. It's also described in the instructions that are attached if you have more questions specifically about that. The second page is, this is just helpful information for you, for the nutrition service provider. For example, are they able to prepare food? Are they grocery shopping? What does their kitchen equipment look like? And about the middle of the page is the box for reason for home delivered meals. So you can check as many reasons apply. For example, if the client homebound, permanently disabled, temporarily disabled, is this for respite? Is this for a meal or spouse or disabled adult living in the home of an eligible client, or other? So we'll give you an opportunity to explain any other circumstances that you feel are appropriate for home delivered meals. And then the next box would be just to tell us what is the benefit of the client receiving the meal. Further down, of course, we're asking for the physician's name, an emergency contact. One suggestion that's been made is it would be helpful to know the relationship of the emergency contact if you are aware of that or can add that. There's an authorization release for information. If you are using the fillable PDF, we do allow for the client to sign electronically. And then we're asking for the case manager's name and contact information. So if you know the start date, it could be immediately. You can also include the reassessment date, which would be 1 year from the original assessment date. There's also an opportunity for short-term or long-term meals, and I'm sorry, that box is right above the contact information. So if you have a client getting out of a hospital following surgery and you know they just need meals for a short time, you can indicate that to the nutrition service provider, so they know that this won't be a long-term problem or service while the client is recuperating. And then at the bottom, just some additional instructions to help the driver, for example, if there are dogs, if they need to ring the bell or knock loudly.
All right, so that is basically the what we wanted to share with you about the home delivery meal program. You will see that for other waivers, if those waivers, include meals, then the responsibility to cover the cost of those waiver services are passed to the managed care company. That would be the case with the DOORS program in Illinois, for example. For the elderly waiver, the meals are administered through the Older Americans Act, and this is why the managed care companies are not responsible for covering those meals. However, we cannot stress enough, there is some paperwork that has to be completed once a year, and we would appreciate if that is how it's explained to participants or seniors or people that are interested in the program, and explain them that there is an expectation, or encourage them to help contribute with the cost of the meals. A lot of providers will just send them one envelope once a month that basically outlines the cost of the meals, but it's clear there that it's not an eligibility criteria. They're not responsible to pay for it. However, we are required by federal guidance to request any voluntary contributions to the program. So, any questions or anything that you would like to address at this point with the home delivery meal program? If not, we can move on and maybe address some questions later.
Good morning, Jose. We do have a few questions if this
Sure.
feels like a natural place for a pause.
Absolutely.
Wonderful.
Yep.
Our first question is, can an assessment be completed for a member under the age of 60?
So this is Leanne. Is this specifically for home delivered meals? So in the case of home delivered meals, under 60 would only be those two areas that we described previously. For example, a spouse of the eligible member and or a disabled person living in the home. So you would fill out a referral form or contact the AAA. They still would need that information, although you would need to work with the AAA, I guess is what I want to say, because they still need to capture the information, and those would be the only cases where someone would be eligible for home delivered meals that's under 60 through our program.
Correct. And then if somebody is getting waiver services under the home services program at DHS, those are again, the referrals may go to our nutrition provider. However, the expectation is that the managed care organizations would cover the cost of those meals. So yes and no. To answer your question, you can make the referrals. You would be responsible for covering the cost of that under 60, unless that person has a senior in the home, and then there's a disabled child, and those examples that we shared earlier. But these services are predominantly for 60 plus, and they complement the elderly waiver known as CCP. So those expectations, if somebody becomes an MCO participant or client or member, the meals would be provided the same way that it would be provided under the CCP waiver. So hopefully that addresses the question.
Splendid. Thank you. Moving along, we do have one other question. Are all HDM providers required to have an emergency option for starting meals?
For the referral, is what they're saying.
So yes, the statewide form has the emergency box that everyone is using. It is going to depend on, where you are in the state and which provider it is, what their capability is. So for example, there could be waiting lists at times due to the limited funding. So those areas would be determining how they're going to work through that waiting list, and it could be that they're only going to address people in imminent risk or just getting out of a hospital, or they could have to implement a waiting list even for emergency referrals. So again, you would want to talk to your area agency and the nutrition service provider to make sure they're not on a waiting list, until you build that relationship with them and get more familiar with how it looks in that area.
Also to complement what Leanne just mentioned, we provide close to 7 million meals in any given year. We are providing home delivery meals to approximately 43,000 seniors in Illinois. We do have a small waiting list statewide at approximately 400 individuals. And the reason why I'm sharing some data is because I don't want you to be discouraged from making those referrals because there might be a small delay in some areas, because we are definitely pushing to make sure that we're addressing every person that is referred to the program. We are trying to make sure we have the capacity to address any emergency cases or discharge from hospitals, because we know how important the meals are. But at the same time, um, it is difficult to add a large number of new participants coming into the program, especially in areas where we might not have the routes in place or the volunteers to be able to address that. So they do get addressed. Sometimes there might be a small delay, but I guess the main point is don't be discouraged from making those referrals. Communication is going to be key. I would strongly encourage you to have a relationship with a nutrition provider, especially in rural areas. You're gonna know them, their emails, their phone numbers, and things to that nature. So again, it's a matter of communication and making sure we're all on the same page. Obviously, when you're discharging people from Rush Hospital, in the city of Chicago, it becomes a little bit more difficult. Nevertheless, it is important that we get those meals to those individuals in need. So don't be discouraged, and keep working together on that.
Thank you. As a point of clarification, you mentioned every person who receives a referral. Does that person have to be a citizen, or can they be a legal resident as well?
Yeah, this is the beauty of the Older Americans Act. So we protect all individuals. So everyone over the age of 60, regardless of their current status, is eligible for the services. So we do not collect means testing or anything regarding to their immigration status.
Splendid. Thank you so much. I also want to quickly pause and say, for those of you who are watching the webinar live at this moment, all handouts that are being referred to during the presentation, including the referral form, are attached under the handout section on the control panel. For those of you who might be watching this webinar after the fact, those handouts will be sent to you directly. Thank you. And with that, Leanne and Jose, continue on with your presentation. Thank you.
Thank you. Yes, so that is the home delivery meal is definitely one of the most popular programs and services that we provide. But I also want to spend some time in talking about what else we offer under the Older Americans Act and the area agencies on aging. Another popular program that we have is the congregate meal side. So this is basically what we do when seniors want to have a socialization activity. A lot of them are done at the senior center location. So again, another of the things that we're trying to address, and we'll explore that a little bit more later on, is the social isolation component, quality of life, quality of services. So again, if somebody wants to get in touch with a congregate meal side, that is definitely something that we encourage. There's a lot of things going on. We make for example, for St. Patrick's Day, a lot of them are doing a lot of things related to the season, summer events. Foods are varied depending on, Thanksgiving and activities. So the senior centers are not necessarily something that a lot of seniors at first are open to, but once they start going to some of our senior centers and start integrating with other seniors, they definitely love it. So again, if you have somebody that you're assessing and you feel that they could benefit from a coming, once or twice a week to some of our congregate sites, we will love that. We want you guys to be aware of these services and encourage them to participate and be part of the community. That gives them the ability also to volunteer and to be active in other activities as well. This is also another popular service in the Chicago area when it comes to ethnic providers. Leanne and myself and all of us here are proud that we have such a variety of diversity in the Chicagoland area, but also we have several locations where our seniors are eating food that they like, that they're familiar with, that they're used to, and also they have music and things to that nature. So again, the congregate meal side is something that we would like to promote. We have a dietitian reviewing all of those menus to make sure that they're in line in terms of what we are required to do. But at the same time, we want these meals to be something that our seniors like to consume them in a normal and regular basis, and make sure that they get the other benefits with that. So that is the congregate meal side. Information and assistance. This is again another thing we touched earlier on, like the 311 in the city of Chicago. We also have other means from the senior helpline here at the Department of Aging, but the senior centers, the area agencies on aging, they have local providers that provide information and assistance as well. This is another way to describe the no wrong door ideas. We want to make sure that seniors get access to all of the services, even beyond managed care, even beyond waiver services, even beyond the Older Americans Act services. We try to hook them up with housing assistance. We try to hook them up with the energy assistance program. I know for the managed care organizations, this might not be too relevant, but we also help with Medicare Part D, Medicare savings program. We help them stay Medicaid eligible, which is another component that we all want to make sure that if they're eligible for Medicaid, to stay on Medicaid to maximize the federal funding, but also make sure they stay on managed care, because that's another problem that we have. If somebody goes through the process, they become Medicaid eligible, they're switched to a managed care company, and for one reason or another, they lose that eligibility, then we need to go back to square one. So again, information and assistance is another service to support all of our efforts, whether you're a managed care company, a waiver services, or the Older Americans Act. I think we're all serving the same individual, so I would encourage you to get familiar and advertise our information and assistance options.
Jose, I'm going to pause, and I wanted to note that you have disconnected your slides and presentation from our presentation today. For those of you who are viewing, we apologize for the screen's not advancing. We will work to rectify that as soon as possible. In the meantime, continue to speak, Jose.
Okay, all right. Sorry about that. I don't know. I got a message here and we got disconnected, but yeah, thank you for that clarification. So transportation, it's another thing that we do provide. There's different levels of transportation: assisted transportation, regular transportation, and also we are proud that we have the fixed route transportation for seniors, which is through the benefit access process. It's more for like metro areas, Chicago, the CTA. So we are trying to encourage seniors to be active, to get around if they can. So again, transportation has many different ways. So we do have those services as well for doctor's appointments, door-to-door transportation, assisted transportation, and the fixed route transportation, which is the bus, the train, and things to that nature. So again, want to make you guys aware that that is also available for seniors across, and we are funding a lot of those services through the Older Americans Act. Touched already on some of the assisted transportation here. You'll see it on this slide. Where we actually take individuals to doctor's appointments. We stay with them. We bring them back home. We assist with wheelchairs or potentially other things that might be in line with that in terms of dementia and Alzheimer's, and make sure they have somebody with them in making sure that they go from point A to point B safe, and then they return home. Respite. We talked about that as well. Respite care. This is something that is not offered under our waiver, but it is necessary. Respite care helps caregivers A lot of times we have a lot of caregivers that are providing additional care beyond that what we can provide. So respite care is something that could help you keep your members in the community safe, but at the same time support the caregivers and give them a break from their duties. And sometimes they go on vacation or you need some help for whatever reason. These are available. Again, I would encourage you to touch bases with your area agency on aging and get familiar with the process, get familiar with the paperwork and the assessment that has to be done to determine how many hours, what day they're gonna come. And a lot of times you'll be surprised, but you might be already doing businesses with the same agency in terms of the in-home services. So that might be something that you can coordinate at your level with the in-home provider. Legal assistance. Again, this is something that we are required to provide, and it helps with guardianship. We can help with advanced directives. We also help with seniors or 60 plus or older adult individuals that are raising their grandparents. They're raising their grandchildren, their grandparents, and now they're responsible for a teenager, or they need to deal with temporary guardianship because the parents are incarcerated or they're ill, and then they're responsible now in their late 70s to a 5-year-old. There's a lot of things, unfortunately, that happens that way, and our responsibility is to support them with gap filling funds to address those needs, but also there's legal needs that we might be able to assist in many areas. So again, I encourage you to touch bases with your area agency on aging to talk about how those legal services are provided to this population in each PSA.
Sure. Disease prevention and health promotion. This is a specific part of the Older Americans Act that requires these funds to be used on evidence-based programs. So that's why you'll see they have specific titles. Maybe you've heard of A Matter of Balance or Chronic Disease Self-Management or Healthy Ideas. They have been proven as evidence-based and effective and published in medical journals. So there is special funding for the area agencies to choose which program is needed in their area. Typically, they have like a class, like chronic disease self-management. Your AAA would know like maybe when the next class is that you can refer your members to help with falls prevention and other healthy programming. The Family Caregiver Support Program, we also just refer to this as 3E if we've mentioned that before. So this program is specifically for informal caregivers of individuals over 60, grandparents raising grandchildren, or now referred to as grandparents or older individuals who are relative caregivers. You can also be a caregiver for an individual with Alzheimer's disease or a related disorder, even if they're not quite 60. So again, we touched on this earlier. These services, there's a wide range of services, and they can look different in different areas. So it's possible you'd have information and assistance, public education, support groups and counseling, legal assistance, respite, or maybe even gap filling funds. So if you come across someone in need of services that sound like they may fit that category, we would encourage you to contact your area agency on aging to see what's available in that area.
Yeah. So that is basically an overview of what is available through the state and the matching, the Older Americans Act federal programs, and the matching funds that the state of Illinois provides to complement and supplement those federal initiatives. In addition to that, the Department on Aging and the state of Illinois has created its own services for different initiatives. So we do have an Alzheimer's disease related disorder initiative. This is $1 million that was put in our FY20 budget. So these services are brand new, and this is why we wanted to add this to the presentation today to make sure you guys are aware of these services. So basically what we are trying to address is the Alzheimer's, dementia-related issues, because our population keeps living longer, but also we're starting to see that in the community, we're serving individuals with chronic disease, multiple medications, multiple medical conditions. So it is becoming harder and harder to address and meet the needs of those older adults in the community. So we do have an initiative. This is a new program. Again, it started October 1st, and we are proud to announce that we're providing Savvy Caregiver and a busting caregiver trainings for our caregivers dealing with a loved one or an older individual with struggling with Alzheimer's. So that is something that we recognize, and this is definitely not everything that's going to take care of the current need, but it's definitely a start for us to address those needs. And we also have gap filling options to try to address those needs, whether it's grab bars, maybe some security alarms in the home to make sure that that we are addressing the needs of individuals with Alzheimer's and making sure that they're leaving home safe in a safe environment. So that is something that's happening now, and we will do. We'll hopefully expand it in the future. And social isolation is another thing that is new. It started again October 1st. So we do have a campaign about social isolation. It's a statewide campaign. It's called Engage Illinois. We are partnering with all 13 area agencies on aging to provide these services. And this goes back to the congregate meal side. And we are trying to do a better job making sure that these services through the Older Americans Act and the waiver services are offered to everybody. So we are doing a campaign to make sure that we bring those seniors that are socially isolated for different reasons, loss of relatives, spouse, LGBT, poverty, anything that would put somebody in isolation. We want to make sure we address those needs. We let them know what's available and bring them back and make sure that they have an option to connect with services. So in the slides that you have, because these services are very unique and different among all PSA. So we're all trying to combine social isolation. But again, going back to the Older Americans Act, every PSA has a different way to provide those services. So when you see the PowerPoint that's on the attachment on the email, you'll see in every PSA how we are addressing social isolation. There's a lot of things that are similar, but there's also a lot of things that are different. But I think your members will appreciate the uniqueness of those services and how they're different, and to make sure that we have a person-centered approach and make sure that we're bringing everybody up to speed and connect them to services. So the last slide we have before we open it to questions, because we do want to have some time at the end to see if there's any questions. We cannot stress enough, make sure you build a relationship with your area agencies on aging. You have a contact list. All the executive directors and their staff are very friendly and eager to work with the MCOs and this and many other initiatives. We also have the senior helpline, the 1-800-252-8966. The numbers again on the PowerPoint. And this is where also we provide adult protective services as well, information and assistance. And we do have the department website. On our website, we develop what's called the provider profile, where you can do an advanced search, and based on the county, you can narrow down your search about what's available in terms of the in-home services, EHRS, which is the Emergency Home Response System. These are all waiver services. However, we do have information about the area agencies on aging and the Older American Act services. So that was a lot. Hopefully we cover everything, but we're definitely open for questions. So we do have some time now. I don't know if we can address one or two if we still have time.
First of all, I just want to pause and say thank you so much, Jose and Leanne, for your wonderful presentation. I received a lot of feedback as we were moving along the slides, and there was a lot of appreciation. Unfortunately, I am seeing that we are at the top of our hour now. We did ask some questions during the presentation, so thank you so much for that. I'm going to pause and say, If you are watching this presentation live and you submitted any questions that we were not able to get to, we will be able to connect with you after the fact and send our answers to you. With that in mind, I received a lot of questions about how wonderful the presentation was and whether they could receive those handouts. Once again, we will be sending out the recorded version of this presentation as well as the slides and all of the handouts that were discussed. Jose and Leanne talked a few different times about how opportunities to connect and outreach with those individuals and the list of contact information. We will be circulating that around so that you do have access to that. With that in mind, I'm going to hand it off to our presenters one last time to see if they have any final remarks or closing comments before we end today's presentation.
No, we definitely want to say thank you as well. We are in this together. We are servicing the same individuals, and we look forward to the collaboration, the questions. I apologize. Somehow we disconnected the presentation, but definitely we'll make those available. And if you have any other topics specifically, if in the future you want to take one service and maybe have more in-depth discussions about that service, we're happy to do that as well. And on behalf of the department agent and Leanne, we thank you for your time.
And on behalf of IMHIP, we also thank you for your time and everyone who attended. With that, have a wonderful day. We'll talk to you all soon. Goodbye.